morning, doctor. I'm Shubha from grade 2 Society.
And I'm Samsidh from grade 10M. Here we have a visiting ophthalmologist here with us. Ma'am, could you please introduce yourself?
Yes. Myself, I am Dr. Shubha. I studied my MBBS from KVJ Medical College. Then I joined ESI. It's a government insurance hospital. I worked for 5 years. Then I got a PG in Bangalore Medical College in the Department of Ophthalmology. I did PG from the Bangalore Medical College. Then I started continuing in ESI Hospital, Indiranagar. At present, I am working in ESI Hospital, Indiranagar.
So, ma'am, could you talk about any common misconception about eye health and what is the treatment for these normal misconceptions?
Okay. Most of the time people will think the headache, all headaches is because of eye problem. It's not that. Like there are so many reasons for the headache. Sometimes migraine or refractive error is one of the reason. And most of the time there will be no eye problem, but we will diagnose other systemic illnesses. So sometimes, most of the time, like ophthalmologist has a doctor, we will diagnose a systemic illness that will be reflected through the eye.
Thank you. So the next question is, how does screen time and digital devices affect eye health, and what advice do you give to mitigate the impact?
Okay. Nowadays, as gadgets has been increased, like use of gadgets has been increased, like so kids, not only kids, all the elders also, they will be seeing more time on mobiles, and we continuously seeing like without blinking. Actually, we have to blink like at least for 2 to 3 seconds once. On blinking, what will happen is there will be a tear film layer that will cover. Actually, that will also help for the refraction, means to increase the power. So if we start continuously staring, the cornea will dry up. So because of that, the cornea health may be become defective. So we have to blink often. And for other people who use continuously these computers and all, I will advise them to take at least some 5 minutes break in between every 30 minutes.
So, ma'am, could you talk to us about the revolutionary changes that has happened during the 2020 COVID-19 pandemic?
After pandemic, yes, it was a very tough time for a medical field, COVID-19. As an ophthalmologist, after COVID-19, we have all other profession, even we started the telemedicine. So during COVID time, for other causes, it was not accessible to come to the hospital, right? So we started telemedicine. Now also it is continuing. That was one revolution what was added after the COVID-19 in the medical field.
As we know, medical field is a field that is extremely vast, but it also has a very human side to this. Could you tell us any heartwarming story or anything that was heart-touching for you during this COVID-19 pandemic?
There were so many, like when I was working in Victoria Hospital, there were so many stories. Like one shift we used to go and we used to see the patient, they used to speak with us, like we used to see, and they will be sitting normally, and next shift when we go, that bed will be empty, and we will ask, where is that patient? Yesterday he was alive. That we would have heard, like we will be hearing that he was no more yesterday evening in another shift. It was very heart-touching. And one story which it was very heart-touching to me is when I was working in Bowring. After COVID second wave, that mucormycosis, which was related to eye, it was very much increased suddenly. It was a fungal infection to the eye after post-COVID. So one kid, actually it was not affecting the kids. That kid, she was a diabetic, so it was affected to the eye and to the brain also. It was infected, so that kid had a surgery. Once I went to do the dressing for that kid, so because it was affected to the brain, the craniotomy means they will remove the part of the cranium. So for the dressing, so the kid was there in the ward from past 2 months. So when I went, the kid, when I just opened the dressing, the kid looked at me through one eye, and the kid told me, when you will discharge me, madam, with a smiling. It touched me like to the core. Still I can remember that face of the kid.
What advice would you give parents to guide patients to maintain good eye health and throughout their lives, and why is it important?
Yeah. As I said before only, like when they are using a lot of computers and all, to take a break in between and doing eye exercises like moving and pull and push-ups exercise we'll advise for some people, and having good nutritious diet like vitamin A rich carrot, all vegetables for the kids. It's very much important. And if the person is feeling that he cannot see near or far, especially for the kids, I would like to, that's why there is a program like in the school only we'll start screening. There are so many programs which is school, because if the kids, they will not use the glasses at proper time, in the proper age, they will not get the vision back. We cannot do later anything. So in the school age only, it is very better to screen them and to start using the glasses. It will make a lot of changes for them.
And like we now understand the plight of doctors, how much they suffer just to give back to humanity. It's like they take the suffering of others just to reduce the suffering of themselves and everyone else around. So would you like try to share your experiences on how it was in Samsidh? How it felt being appreciated?
We take up the profession to serve. When we choose the profession only, we have to decide that, as I told, it's not just a career. You are choosing to do the service. Like we would have chosen this career to serve for the humanity, and today I was very happy, as I told, like I was very happy to come here to see you, all of you here, and I was very thankful to call me here today on this occasion.
Ma'am, you can surely say the same. Thank you so much for visiting and helping us, giving us the opportunity to appreciate you and all doctors that is there around the country. The chance to appreciate them truly is something that very few actually do. Yes. Thank you.
Thank you.